Okay. All right. Good evening, everyone. Welcome to a discussion of preventing gun violence sponsored by the League of Women Voters of Colorado's Task Force on Gun Violence Prevention. I'm Rianda Osman, and this evening our guest is Molly Siegel, Director of the Office of Gun Violence Prevention. This evening, Molly will give us an overview of the work of the Office of Gun Violence Prevention and her plans for the future. We're recording this session, and the recording will be posted on the League's YouTube channel. Molly will have time to respond to questions, and I ask that you put questions in the chat, and we will address them at the end of her remarks. Before we start, I'd like to remind all of us that the League of Women Voters is a grassroots organization that has worked for over 100 years to improve local, state, and federal government and to engage all citizens in the decisions that impact their lives. The Colorado League was founded in 1928, and we've been working since then. The League neither supports nor opposes candidates or parties, but we do interact with elected leaders at all levels based on our positions on public policy issues. Our positions are formed after member research, study, and consensus, and we are passionate advocates, both men and women, who work to influence public policy issues. And now I'm pleased to introduce Molly Siegel, who has been in her job for a very brief time, just a few weeks, but I'm sure she has lots to tell us. Molly, it's over
Thank you
to
so
you.
much. Thank you so much. Can you hear me okay?
I can, yes.
Okay, great. Just wanted to make sure. I appreciate the introduction. I appreciate everyone being here and giving some of your time to hear more about the Office of Gun Violence Prevention. Today, I will talk about what the office is responsible for in statute, what some of our key activities are, what the goals are, how we engage in a range of prevention activities, services, and programs. I do want to say that the office is neutral in terms of gun violence. We know that this is a highly polarized issue, and we work with people on all sides of the issue and really focus on reducing the harms associated with firearms. So I wanted to start with introducing myself. I haven't met all of you. I'm thrilled to meet you, and I've been in this role for 4 months now. I'm really honored to be in this role. I have 15 years of experience in healthcare policy, program implementation, and evaluation. I work for state government in Illinois, implementing innovative community care coordination programs focused on social drivers of health and behavioral health. So really interested in how all these different disciplines and areas of work interconnect, and how we address the upstream factors related to gun violence prevention. I've worked in Medicaid in both Illinois and Colorado. I've also worked in health technology. I've worked in a variety of places, and have volunteered as well on gun violence prevention, which is really what deepened my passion for this issue, and also becoming a parent and really wanting to fuel that passion and sometimes anxiety into action. So that's why I'm here, and I'm very excited to be here and to be doing this work. So the Office of Gun Violence Prevention was created by statute in June 2021. We've had one director before me. There was a little gap in time before I was hired, in which my boss, Carrie Cortiglio, was leading the Office of Gun Violence Prevention. But statute lays out very clearly some key responsibilities of the office, which includes conducting and refreshing a public health awareness campaign about how to be safe with firearms, how to engage in safe storage. It's largely directed at the gun owning community or family members of gun owners, and we can talk a little bit more about what that looks like. We also have a community grant program, as we recognize that there are so many incredible community-based organizations who are doing a range of work to support prevention activities, from gun violence primary prevention to secondary prevention to interruption, and addressing a variety of types of violence, from suicide prevention to community violence prevention, to unintentional injury. So we support right now 6 community organizations who are getting large dollar amounts from us to do a variety of work, and I can tell you more about who they are. We also create and maintain a resource bank, which is essentially a repository of data on firearm mortality and morbidity in the state of Colorado, along with other things like firearm sales, extreme risk protection orders. We also have a huge body of research from the University of Colorado Anschutz, one of our key partners, that talks about what the best practices are and then how to implement them in your own communities. We also collaborate a lot with a variety of partners. A huge part of my job is stakeholder engagement. That's why I'm here today, to listen to you all and hear what some of the biggest challenges are that you see, how we might be able to help, but be a voice for the variety of folks working in this space. And first and foremost, ensure that we're coordinating across local and state government too. So we ground ourselves in a public health approach with the work of the Office of Gun Violence Prevention. So we work to be on the same page with a variety of folks, including folks who have different opinions about guns, to define and monitor the problem. We work really closely with the gun owning community through the University of Colorado Anschutz. They've built out a coalition of gun owners who are all really passionate about safe storage. And those are trusted messengers who are out there in the community talking about the importance of safe storage. We also want to identify what are the risk and the protective factors. And I know if you attended Lena's presentation from the Office of Suicide Prevention, she talked about this. What are the things that can make a community or an individual more at risk for violence? So for example, if there's not as much lighting in a community, if there's not as much green spaces, that can create more risk for violence. But then what are the protective factors? So increasing that lighting, increasing the green spaces, increasing access to mental health services, those are the protective factors. We try to ground ourselves in that understanding and in identifying and creating more ways to get access to those protective factors. And then prevention strategies, being able to develop and test what's working and learn from each other. So those 6 community organizations, we are looking to them to teach us and teach the rest of the state about what works and what's effective. And then thinking about how we can scale some of that work, recognizing that each community is different and has different needs, but there are opportunities to scale. So now I'm going to talk about each of the areas that the office is working on and what that looks like. So in those 4 areas we talked about that are written into statute, one of them is the public awareness campaign, and that's called Let's Talk Guns Colorado. So if you haven't seen it yet on our website, would really encourage you to take a look at it. We're on social media, we're on radio, we're on TV. We try to choose a variety of outlets to be able to share this messaging far and wide in Colorado. It's a kind of thing where any of you can repost what we have on social media. You can share it on your own websites. If you have any feedback or ideas about this, please feel free to reach out to us as well. We are talking about things like safe storage, Colorado laws, what are extreme risk protection orders, or commonly known as red flag laws. How do you get access to mental health and substance misuse resources, since we know there's a strong connection between that and firearm injuries that are occurring? So these are some of the key audiences. So when we design our campaign, when we design what the messaging looks like and how we deliver it, we're thinking about these audiences. So we're thinking about engaging gun owners. We're thinking about how to support folks who are living in households with people who have guns, who might be afraid themselves, might be looking for ways to be able to help somebody, let's say in a situation of suicide, or are trying to learn as parents and legal guardians what are the safe storage best practices. We're also really focused on helping to train specifically healthcare professionals on what different options they have to both talk to their patients about firearms, create safe storage plans, and then as a last resort, engage in a ERPO or an extreme risk protection order if that's necessary, but making sure that they know how to do that and have the support to be able to do that. So we've spent about $500,000 on our both our campaign to be able to focus on extreme risk protection orders as well as our grant program. So you can see just kind of where some of our funding is going to. This is the only source of federal funding that we have, and it's being administered at the state level through the Department of Public Safety. So in case anyone was going to ask about our concerns about federal funding, we are very thankful to be in a position where we get a good amount of money each year, $3 million from the general fund. And so we rely on this one additional federal grant that we believe will continue, but we still have those general funds to support this type of programming too. So we're not as worried right now for our particular office, certainly for public health more generally, but our particular office is in a good position. And then to share a little bit more about the grant program. So as I mentioned, we've put some dollars toward both the grant program and toward our campaign. We've released $1 million in total that includes the grant program and the campaign. So sorry, I might have been confused with the $500,000. So focus more on that 1 million. And so just so you know, like the trajectory of the grant program, this is what it looks like. And then these are examples of previous grant programs that we have provided. So Mind Springs Health is a community mental health center. Community Pearl does youth leadership work, youth development work. Bridge to Justice in Boulder focuses on extreme risk protection orders. So that already shows you a variety of work that we do. These are current grantees that we provide funding to and do really fantastic work. So Garfield Youth Services or Youth Zone, they are in Garfield, Pitkin, and Rio Blanco counties. So they're helping to provide wraparound services to families that are impacted by firearm violence. So types of restorative justice practices, and then the Denver Youth Program or Metro Denver Partners, that's a hospital violence intervention program. And that's at Denver Health and University of Colorado Anschutz. And then Joint Initiatives is doing some great work in El Paso and Teller counties where we see a higher rate for some types of violence. And they're also doing wraparound services and counseling and specific mental health support for youth who are at risk. And then American Academy of Pediatrics, really excited about this too. They have a campaign called Secure Their Futures that they're doing in Arapahoe and Douglas right now, hoping to roll out more widely, but it's focused on training pediatricians and pediatric practices to talk about firearm safety and the lethality of firearms and the risk and the prevention that is so critical to engage in for our kids out there. And they give away free cable locks. And I was just in a meeting earlier today with local public health agencies talking about how important it is to engage with pediatric practices. So hopefully we can roll that out statewide. And then Speak Up, Reach Out is in Eagle Valley, and they do a lot of great suicide prevention work and talk about lethal means, safety, and harm reduction. And then Struggle of Love is in the Denver metro area, and they're doing a lot of great work around violence interruption, around continuing care of mental health services, trying to interrupt cycles of trauma and violence that are occurring as well. And then this is the resource bank that I mentioned, the repository of data and research on what are effective practices for firearm harm reduction and violence prevention. So happy to share more about that here. That's in partnership with the Colorado Anschutz Medical Campus. And then these are the kinds of themes that we're looking at with our research. Different types of violence. So it makes sense to isolate the research on these different types of violence because sometimes they require different interventions. So community violence, which can include gang violence, intimate partner violence, and domestic violence, which is a strong interest of mine. If you're curious about some of the things that I want to focus on as well for the office, that's one of them. Youth violence and suicide. And then that also has fact sheets and information about safe storage, extreme risk protection orders, and then access to mental health resources and the importance of that when there are firearms in the home. And then we have our data dashboard, which if we have time for today, I'm happy to show you what that looks like. It has a variety of data in it, but it's a great resource and great for data storytelling. For one, I think folks aren't always aware that the leading cause of firearm death in Colorado is suicide, although that has decreased over the years, and the Office of Suicide Prevention has done a lot of great work in that area. But even just kind of teaching people more about what the data tells us about where gun violence is occurring and in what ways, I think is really important. And we see mass shootings in the news a lot, and there's a lot of media attention on them, which is really important. And we need preventative practices for that. But the suicide risk is really high. And so if we're thinking about, for those of us with kids, whatever age it is, the safety of our kids for mass shootings, we should also be thinking about the safety of our kids when it comes to suicide. So to just share a little bit of data with you, this is the type of data that we have in our data dashboards. 16.7 is the overall age-adjusted firearm death rate in Colorado, so it's higher than the national rate, and that is largely driven by suicide. So then if you scroll over here to the right side, 11.4 makes up that's the majority of that 16.7%. 4.6 represents the homicide rate, which is lower than the national rate. Still something we work to do something about and be preventative about, but I think it's helpful to have that context. And then this is a view of the dashboard that we have that I said I would be happy to show you. It's really interactive. So you can see Colorado in context. You can see that firearm mortality data that I just went over. You can see mass shootings and the number that have occurred and how that's changed over the years in Colorado. You can see the amount of extreme risk protection orders that have been filed in the state of Colorado. You can see firearm sales data, which actually has gone down in the year 2024. There are less firearms being purchased. And then you can see practices when it comes to firearm access and storage that is self-reported through a survey that is done by our partners at University of Colorado. I think I'm going to skip over this for now just for the sake of time, and we'll come back to the data if that makes sense. I did want to touch on the extreme risk protection orders, since that's a key part of the work that our office is doing. We always try to emphasize that there are other options that can be pursued. For example, if someone is in a mental health crisis and wants a friend or a trusted family member to hold their firearms and they're able to engage in that process, that's wonderful. If their mental health clinician is able to help them facilitate that, that's wonderful too. If there is a situation where there is extreme threat and there's extreme risk and other options have been tried, then an extreme risk protection order is a good path to go down. And now in the state of Colorado, law enforcement can file extreme risk protection orders. Educators, which is schools or universities, and as well as healthcare professionals, which includes mental health professionals. And so we are putting together a curriculum that will teach these healthcare professionals how to go through the process of filing an ERPO and working with law enforcement. So since ERPOs were first introduced in Colorado in 2020, they have gradually gone up. So we've seen 275 that were granted between the years of 2020 through 2023. Of all the ERPOs that are requested, about 67% are granted, and we can talk about why that is too. The majority of ERPOs were filed due to threats against others, although ERPOs can be used for both threats against others and threats against self. So in the example of suicide, let's say that someone has, it's a friend of a friend and has tried a lot of other things to help them, but they know that that friend is suicidal and has a firearm in the home. We know that when there is that threat of suicide having a firearm nearby is going to make that suicide more successful because of the lethality of that. And so that friend can engage in going through the ERPO process to protect their friend. And then these are some of the key partners that we work with. So the Trailhead Institute, the Office of Suicide Prevention, the Colorado Safe Futures Fund, which is 11 philanthropic organizations who've come together to create a fund of dollars devoted toward gun violence prevention. And they've raised about $1 million. They'll continue to raise more. Some of the participants are the Colorado Health Foundation and the Rose Foundation. So we're really excited to partner with them. We work really closely with the University of Colorado, as I mentioned, at Anschutz, the Office of Health Equity, environmental data within CDPHE, and then many other state agencies like the Department of Education, the Office of School Safety, the Behavioral Health Administration, and Public Safety, as well as the Office of the Attorney General. Okay, I think I'll stop there so that we have enough time for questions, or if there's more time and folks want to dive into the data, we can do that too.
Okay. Well, we have one in the chat.
Okay,
Uh,
great.
Cindy Sestrich asks, what is the basic controversial law that the people of Colorado who just asked the federal department run by Pam Bondi to look into the Colorado gun laws? What is the basic controversial law? Does that ring a bell with you, Molly?
No, is this a recent law or is this?
Yes, this is Senate Bill 3,
Oh,
which
right.
is
Yeah.
the
Yeah.
the semi-automatic
Of course. Yeah.
the bill to limit semi-automatic
Hmm.
uh, weapons. The governor just signed it, and
That's right. Mhm.
this is part of the pushback which normally happens to these things. So it's not going to go into effect until 2026. And first there will be, all of the hoops that we have to jump through
Mhm.
to do these things. So that's the law. It was Senate
Okay.
Bill
Yeah, it's Senate Bill
3.
3. Yeah.
Yeah.
Yeah, I'm familiar with that. That's a big one. It went through about 30 amendments. But it did pass, and I know we're very interested in understanding how it's going to be implemented, and we plan to put together a fact sheet about it. So, what are all the new processes? What are the changes? And then who's responsible for administering them? And how does it affect the gun owning community? How does it affect others? How will it be enforced? So, if that, I don't know if there's another question in there, but we're certainly going to get more information on it and share that.
Okay, Cindy, if that answers your question.
Yes, it does.
Okay. All
Thank you.
right,
I
good.
do I do have another one.
Oh, well, have at it.
I have heard of some law enforcement agencies that will not enforce state gun laws. Do you work with those people and try to come to a common understanding, or how does that play out?
We do, yeah, that's a really good question, and you're absolutely right. I just sat through a presentation with the Denver Police Department, and they have just done such an amazing job of adopting and educating their own workforce about ERPOs. But that's not the same in every county and city and every police department. We recognize that, so we've definitely identified that challenge too. It's a lot more effective to have other state agencies be the ones who are trying to get police departments to adopt these practices, to enforce these laws. And so what we do is we work really closely with the Department of Public Safety and the Attorney General's office. Those are the folks that are out there partnering with police departments, trying to train them, trying to kind of shift their behavior. So we're in the background providing data, providing best practices on that training, whatever we can do to help if it's funding too. But it's a lot more effective if it's coming from public safety. Those are a lot of former police officers themselves, so they're trusted messengers.
Has that process been successful?
Yeah, I think it has in some places. I think it's just a slow process. It takes time to build trust and to see behavior change. I know that the Attorney General's office is finalizing their own curriculum for law enforcement on extreme risk protection orders. So once that gets rolled out, then we will see police departments having access across the state to more training about this in a consistent way. So I
Mhm.
think that will also create more of a shift.
That's
It's
great.
it's always going to be it's always going to be challenging though. I mean, I talked with public health folks from El Paso today, and they have challenges across the board of getting their local government to recognize public health as a thing, period. So it affects a lot of different things that a county is trying to do.
Yeah. I just wondered if it was an urban versus rural issue, or can it be that well divided?
Not always, actually. There are some rural police departments that adopt this, and in other states too. So I don't think it's always that.
Okay, thank you.
Yeah, yeah, it's a good question.
Molly, you had said that 67% of the ERPO requests are granted.
Hmm.
Um, what's missing in that third?
Yeah, and that's from data up until 2023. So I
Ah,
think every year we are getting better at educating judges, educating law enforcement about how to make these successful. We've seen that purpos are usually successful when they're filed by law enforcement. So making it easier for like a school or a healthcare professional to get to law enforcement to report an issue means that the law enforcement can go through those the phases of applying for the ERPO and showing up in court, since that's a requirement. So we've done some things to try to make up that difference of what's getting granted and what isn't. But also what that could mean too is that if every ERPO starts with a TERPO or a temporary ERPO, and it could mean that other methods were obtained, like getting somebody connected to mental health counseling, or a judge deemed that the risk wasn't as high as maybe originally thought. So some of those are reasonable, and some we can do more to educate about.
okay. Well, one thing I've wondered about uh, ERPOs in general is that, we advocated very strongly to, you know, get this
Mhm,
instituted in Colorado
mhm,
and then expanded the who should be able to file for
mhm,
ERPOs and, in general trying to make it all work. But it seems that there are many other um, recourses that one could go to. Could you go over some of those and why they would be perhaps better than an ERPO?
mhm. Sure. Yeah. I mean, just giving the example of if we're talking about a healthcare professional like a mental health counselor or even your primary care doctor, we want people to tell those different types of folks that they have a firearm in their home. We want it to become more commonplace to be able to share that, so that then that healthcare professional can talk about the importance of safe storage and um, how more likely you are to, die by suicide if you have a firearm in your home, or unintentional injury, and how securely storing those firearms can make a difference. In order for those healthcare professionals to have that conversation, they need to build trust. And amongst the gun owning community, there is a lot of fear about ERPOs, and a lot of fear that if they tell someone like a healthcare professional that they own firearms, that healthcare professional is then going to go and file a risk protection order on them and get those firearms taken away. Um, and then they could retaliate even more. And so ideally, we want to preserve that trust that has been established by making sure that that individual is like engaging in other practices like I mean, we want anyone in Colorado that has a firearm to secure them safely. Like, I think that's step number one. So if we can achieve better results with that, I think that will put us in a really good position. And kind of, I think it's focusing on that. It's trying to make progress that way, having a safe storage plan. Um, if it's a situation in a school, for example, where a threat has been noted and they're able to figure out resources to help that student, mental health resources, resources to address social isolation, then removing the firearms might not be needed as well. So it helps to be able to show that other options have been pursued before that, to know that like this really is an extreme situation.
Thank you.
Sure.
We
Yeah, it's a
we
great
have
question.
a
Oh,
question from Leslie O'Brien who says, "Can you speak to the proposed bill
yeah.
House
Mhm.
Bill 1250, educating K-12 families about secure storage laws?"
Yeah, I think that one will likely pass. That's the one where we would be posting information to make it easier for schools to access training on safe storage or education for parents and guardians on safe storage. I think what we've heard as feedback from schools and school districts and school communities is that understanding of the importance of securely storing firearms is not widely available, and this would make it widely available. And possible partnership with GVP, secure storage organizations. Is that asking about like getting access to firearm locks? I don't know if you can come off mute, Leslie.
Leslie, you're on mute.
Sorry about that. Just picking up my daughter, but I'm hands free. So,
No worries.
my, no, my question is, so I'm a volunteer with, Be Smart, which is a secure firearm framework, education
Oh,
framework.
great.
And so, I guess I just know that there are a lot of people in the space, and I know Let's Talk Guns Colorado is a very robust website, but I do know that with the budgeting process that we have experienced within Colorado this year, just that funding is so tight,
Right.
just seeing what opportunities for, like if it's not on the website, are there other options that schools might be able to get resources from, like I said, other
Mhm.
secure storage education frameworks, either through the AAP or Be Smart
Yeah.
or, whatever other organizations.
I think AAP would be a great option. I think also our friends over at the Firearm Injury Prevention Initiative at the University of Colorado have some resources for that too. So I'm happy to chat more. We have some spend down that we're doing before the end of the year. They're mini grants under $10,000. And we're seeing a lot of applicants, specifically local public health authorities, use them for education and for distributing gun locks. So I think they're also in a good position to partner with schools to do that.
Oh, cool. Good. Thank you
Yeah,
for that.
sure.
So
Are
we
there,
have a,
oh,
go ahead.
are there ways that I can support all of you in your work, or the office can support all of you? That's a question I have too.
Well, while they're thinking, I I can tell you that the league is very interested in education and spreading the word. And so being here helps us quite a bit. What sort of messages do you think our public need? I mean,
Mhm.
we talk about ERPO, but I have to admit that the sorts of programs that I've heard have been very high level
Mhm.
and, not being on the ground, so to speak, I'm not sure, how useful we are. What
Mm-hmm.
what else would you need from us, frankly?
Yeah, I think we want to put together like a more detailed training that can be available like for the average citizen if they're interested on how to file an ERBO.
Mhm.
But I also think it would be really effective to learn how to communicate with your local law enforcement and work with them, since we've seen it be more successful if they are the ones filing the ERBO. So I think that's some messaging and education that people could benefit from. If they're not sure how to contact or how to talk with their local law enforcement. And depending on what city or county they're in, it might be more challenging. So helping them kind of navigate around that too.
Okay.
Yeah, I think understanding the risk of suicide by firearm in the state is incredibly important. Continuing to message and educate about that. Educate about the lethality of the firearm, how much more likely you are to die by suicide if you have a firearm in your home, and the importance of securing it in the best practice of secure storage. It's not, the kid knows where the key is and they can get it anytime and open the lock. That's not best practice. So really understanding what the specific best practices are around secure storage. And we have all this on our website too, so I'm happy to share it. Would also be really important. Another thing is understanding the relationship between domestic violence, interpersonal violence, and firearms. So that's something that I'm hoping to work more on and educate about. And I think ERBOs could play a really strong role there in terms of preventing death from happening in domestic violence situations. Helping parents to feel more comfortable to ask, like if your kid is going to go on a play date, you can say, do you have firearms in the home that are securely stored? Asking it that way can help to reduce the stigma around it, but ensure that you are asking those questions, and know that your child will be safe, since we know that some of these incidents are happening from children going to another kid's home and accessing the firearm that way.
Okay. And let's see. Any more questions? Well, let's see. We've still got you for a little bit more time. And as long as no one is going, wait a minute. Okay. Um, we can hit on one of my favorite topics, which is the database.
Sure.
Yeah. How complete is it now? How much is it used? What kind of plans do you have for its future?
Would you like me to show it to you while I answer questions?
Well,
Would that be
yes, I would
helpful?
like that. Yes.
I am happy to do that. I really want folks to feel like they can use our data dashboard easily, and that it's accessible. And so I like showing it because it allows you to see how it works and get comfortable using it. So let me just pull it up here. And I will just share that we are in the process of updating it with more current data.
Mhm.
So right now it goes up until 2023, but we're planning to add 2024 data this year, this fiscal year, so sometime before June. And we're planning to add some other data sources as well. So this is really a key place where folks go to find data on related to firearms in Colorado. So this is the Colorado in context, how we compare to other states. We already went over this. We have a higher rate of overall firearm deaths, largely driven by suicide. We have a lower rate of mass shootings. Mass shootings are defined as involving at least 4 or more people. So Colorado in context is one. Firearm mortality is the next one. So this allows you to filter by type of firearm death. and also county. And then if you scroll down here, you can see deaths by county, and you can see kind of the darker colors is the ones where there are more firearm deaths occurring. So you can see El Paso is one of the darkest ones here. Also here, Conejos in Southwest Colorado. You can also see here the demographics of those who die by firearms in Colorado. So for suicide, we see higher numbers of this age range, 20 to 29, and then also the 50 to 59, largely older white males in that category. And then you can see the breakdown by sex, veteran status, and race. Okay, and then mass shootings. So you can see here that we have, it's not a high number compared to other types of firearms deaths in the state, but there were 16 in 2023, and again, that's defined by 4 or more individuals. Extreme risk protection orders, as I mentioned, it takes a minute. We're looking at the amount that have been filed. And so we have seen this increase. So when they started in 2020 from 96 to 168 in 2023. So that's a good thing. It can sometimes be hard to measure the effectiveness of ERPOs because it's hard to prove a negative. You're preventing something from happening, but you can't prove that it was absolutely going to happen, but there is research to show that the use of ERPOs is preventative when it comes to suicide. And there has been more research on homicide as well. And so we'll have that on our website soon too, so you can see too the characteristics of the ERPO respondents. Firearm sales data. As you can see, that's going down in 2024, firearm access and storage. So this is based on self-reported data. So 36.5% of respondents say they have at least one firearm. So this is in the state. 54% have at least one stored unlocked. So there you go. There's still so much more education, especially in rural parts of Colorado, that can happen around safe storage. And we know what happens if firearms are not securely locked.
Right. Okay.
Did I answer your data questions?
Yeah, I
Okay.
like to see what's there. What plans
Yeah.
do you have for the database for the future?
Yeah. To continue to refresh the data, to have up-to-date data, I think we want to also include some crime data. So we want data on when a firearm was involved, but didn't necessarily lead to a death occurring, but just showing the rate at which firearms are involved in violent acts and incidents in the state of Colorado. We also want to include some Healthy Kids Colorado survey data. So that will include more information on what kids are reporting that they have access to in terms of firearms.
Very good.
Yeah.
All right. Other questions? Well, I guess not. You've covered it all. Thank you, Molly.
Of course, yeah.
Yeah, this has been very interesting. Thank you very much.
Good. I'm glad it was helpful.
And I hope you'll come back sometime.
Anytime, yeah, just please let me know. Do you have any information on police shootings? We do. Are you asking about shootings where there was a death or there was injury only, or both? Both. Okay. So on our data dashboard currently, we do have a way to filter by the type of violence, and one of the types of violence is violence that includes law enforcement. So you can see that. But the data that I was talking about, crime data, where it involves law enforcement, but there wasn't a death, that's what we're going to work on adding. Good question.
Okay. All right, then. Thank you, Molly.
Sure, of course, anytime. Yeah, thanks for having me. And yeah, please feel free to reach out if you have any ideas of how we can work together.
We'll keep that in mind. Thank you.
Okay.
Good night, everyone.
Thank you.